Gentlemen, good afternoon, good day, good evening to everyone. My name is Juki. I'm the Executive Director of CARI, and welcome and thank you for taking the time to join us at another edition of our CARI webinar, which is, by the way, now live streamed on Facebook. As some of you may already know, CARI has recently become independent, taken over by our chairman, Dr. Munir Majid, since February, and we have been renamed CARI ASEAN Research and Advocacy. We count on your continued support, and please do reach out to us for research and advocacy work on ASEAN policy issues. And for your information, just a quick one, over the past 10 years, we have accumulated solid intellectual capital on ASEAN integration issues, especially on trade and investment, but we have recently also ventured into climate aligned issue in ASEAN, and that's for that. But now for today, we are delighted to be able to partner with ASEAN Vac Malaysia to organize this ASEAN Healthcare Webinar 2021, COVID-19 Vaccine Rollout and the Recovery of the ASEAN Economy. And it gives me great honor to welcome the Honorable Khairy Jamaluddin, Minister of Science, Technology and Innovation of Malaysia, who is also the coordinating minister for Malaysia's national COVID-19 immunization program, as well as Dr. Khor Swee Kheng, independent health policies specialist. Welcome to the both of you. We had actually hoped that the ASEAN Coordinating Committee Working Group on Public Health Emergency, ACC WGPHE, will be able to join us to shed light on what ASEAN has been doing on this front. However, there is a concurrent meeting, so that they're unable to join us. Now, for background information, ladies and gentlemen, the webinar has been put together as a follow-up of healthcare sector-related recommendations captured in a policy document named A Pathway Towards Recovery and Hope for ASEAN, or in short, Pathway 225, produced in 2020, that's last year, by CARI as the knowledge partner for the ASEAN Business Advisory Council, ASEAN BAC, and the Joint Business Councils. The report contains 225 recommendations aimed to coordinate efforts to help ASEAN-based businesses recover, and we're pleased to note that the report was recognized by the ASEAN leaders, and the input has been also incorporated into the ASEAN Comprehensive Recovery Framework, or the ACRF. Well, there definitely are a lot of issues to be discussed, addressed today, such as the vaccine efficacy, speed, vaccination priority, herd immunity, vaccine passport, travel bubble, and etc. We welcome you to type in your questions in the Q&A box, so that we hope that we'll have time to get to those questions later. Now, without further ado, may I now invite Dr. Munir Majid, our chairman, to take over the session. Sri, over to you.
Thank you very much, Juki. Can I say, wherever you may be, welcome everyone to this ASEAN Healthcare Webinar 2021. And to repeat, the subject is Pathway 225, COVID-19 Vaccine Rollout and the Recovery of the ASEAN Economy. There's been a lot of interest in today's webinar. And as Juki just said, we're also streaming it live on Facebook. No doubt the subject matter has been what attracts people to the seminar. And I would also add that the keynote speaker must have had something to do with it, the fact that the keynote speaker is addressing it. So let me immediately thank YB Khairy Jamaluddin, YBKJ, for agreeing to speak and to discuss with us a matter of great import, which has consequences not only for us, but given the importance of his position, also for him. He has come today from an already extremely busy day. Those of us in Malaysia would know today is Cabinet Day. After Cabinet, there's normally post-Cabinet. And then nowadays, that's the MKN meeting, which is the National Security Council meeting, discussing primarily the COVID situation and so on and so forth. And I dare say his day will not end at the end of this webinar. So YB Khairy, thank you very much again. Well, YBKJ, as Juki said, is Minister of Science, Technology and Innovation. He has been an MP since 2008 and towers above most, I would not say all, that's dangerous for me to say, in politics in Malaysia. And it is not because in the kingdom of the blind, the one-eyed man is king. YB Khairy is really a leader well above most. To many, if not most, he is Malaysia's best hope. He speaks to us today from his position as Supremo of Malaysia's COVID-19 vaccine rollout. After his presentation, our discussant, Dr. Khor Swee Kheng, SK, Dr. Khor, a physician and regional consultant who is an independent health policies specialist, will inject particularly ASEAN Healthcare COVID-19 policy issues into the discussion. So many questions have been pouring in, and those not addressed or not addressed sufficiently in the presentation, I will endeavor to raise when we get down to exchange views as a panel. Therefore, without further ado, it is now my privilege and pleasure to invite YBKJ to address us. YBKJ, please.
Thank you. Can I just do a sound check, Tan Sri? If you can hear me, can you just give me a thumbs up?
Yeah.
Thank you. I've got patchy connection, so in case I get disconnected, please let me know. Tan Sri, Dr. Munir Majid, Chairman of CARI ASEAN Research and Advocacy, Dr. Khor Swee Kheng, Independent Health Policy Specialist, and everyone else who is joining us on this webinar. First of all, good afternoon to everyone, and wherever you are in ASEAN, I hope that you are safe and well, and that you are coping during this pandemic, which has gone on for the better part of more than 1 year. But of course, there is light now at the end of the tunnel with the rollout of the vaccinations in most countries in ASEAN and many countries around the world. In Malaysia, we started our program on the 24th of February, and to date, we've finished our first phase of vaccinations, which is to health frontliners and other essential services. And we'll be moving into phase 2, which is the people who are over 60 years old, as well as people with comorbidities and disabled people on the 19th of April. I've got a short presentation to share. Can I bring up the slide, please? Thank you very much. So basically, the slogan for our immunization campaign, apart from protect yourself to protect others, is vaccines don't save lives, vaccinations do. There's no point buying vaccines, but not rolling them out quickly and putting jabs in people's arms as quickly as possible. And I think that's really the objective for most vaccination programs around the world, most immunization programs around the world, is we want to get this quickly done. Next. So just a little overview of Malaysia's immunization program to those people who are not familiar. Our immunization program in Malaysia is voluntary. It's not mandatory like it is in some countries. I know there's an ASEAN country which makes it compulsory for you to sign up for the vaccination program. We believe that we must start off as a voluntary program because coercion at this stage of the immunization program, I think, sends the wrong message. It can scare people off. And we took the view that the best approach to this was to convince people with the science, convince people with effective communication, effective communication, convince people by a demonstration effect of people getting vaccinated, healthcare workers getting vaccinated, and validating the experience, saying that the experience was a painless, a good one with minimal side effects. We decided early on, as a matter of policy, to make this vaccination free for all Malaysians and also all residents in Malaysia. And I think many countries are replicating this, believing that the COVID-19 vaccines are a public good and a public good that has to be delivered to everybody who resides within the country's borders. We have millions of foreign residents who work here, who live here, who study here, Of course, the SARS-CoV-2 virus does not distinguish between nationality. Nobody is safe until everyone is safe. So we have a program to reach out to foreign workers and foreign residents as well as the number of undocumented migrants here in Malaysia, refugees, asylum seekers, UNHCR, asylum seekers and refugees, working together with international organizations and civil society to reach out to these marginalized population who may be worried about coming out and participating in an immunization program. Perhaps they're concerned and afraid of the government. So we work together with NGOs to reach out to these communities to convince them that it's safe to come out to receive the vaccines. For now, the target age group is 18 years old and above. And of course, we're following very, very closely the clinical trials that some pharmaceutical companies are now having and underway, including the one that Pfizer has just published, saying that the vaccines are very safe for the age profile between 12 and 16 years old. And we will, of course, adjust the age group once those vaccines and the clinical trials show that the vaccines indeed are safe and efficacious for teenagers. And we hope that we can get a result soon so that we can include this group into the vaccination program. We're targeting 70% of our population plus another 3 million or 2.5 to 3 million non-citizens. So that will bring it to about 80% of people within the borders. And we want to get this done within 1 year. As I said earlier, we've just completed the first phase, which is the health and essential services frontliners. We're going for the high-risk groups, elderly, comorbidities in phase 2. And phase 3, we will start on the general population for adults. And we're targeting to start that in May, depending on vaccine supply. We also have what's known as phase 4, which is outbreak management. So in case there's a spike in infections in a particular district or in a particular economic sector, we can deploy vaccines to that particular sector or that particular geographical locality to manage and contain the outbreak. We hope to get this done. This is February 2022 was the old target. I've been instructed by Cabinet, by the Prime Minister, to wrap this up by the end of this year, by December of this year, so we can chase this 80% as quickly as possible, get as many people covered, and get as many people inoculated as quickly as possible. We're using not just government healthcare facilities, but like many other countries, we're using public amenities like public halls, stadiums to be converted to become vaccination centers. Next. Next. So this is just to give you an idea of how we've procured the vaccines. I think the principle was, we started last year, we started negotiating last year. The principle was don't put all your eggs in one basket. And you have to remember that some of these vaccines we negotiated even before there was any regulatory approval, before there was any clinical data that was published in peer-reviewed journals. So like many other countries, we had to make educated guesses. Even certain bets were put down on vaccine manufacturers. So our basket or portfolio of vaccines in Malaysia come from 6 different sources. The first one is the COVAX facility, which is run by Gavi, the Global Alliance for Vaccinations and Immunizations, and WHO. So 10%, we bought 6.4 million doses from COVAX, which can cover 10% of our population. And we have exercised options for Astrazeneca, Novavax, Johnson & Johnson through the COVAX facility. We did this because of global solidarity. At the point of joining COVAX, we weren't sure about the delivery schedule of COVAX, but I suspected that it would not be so quick. And that's proven to be true. So the reason why we've
Juki, we've lost YB's voice. Okay.
Yes, it seems. Let us connect with his office. Just I asked for some patience. Let us find out what's happening at his end.
Hi, can you guys hear me now?
Yes, we
Sorry,
can.
can I just get an acknowledgement?
Yes.
That,
Yes, we can hear you very clearly now.
I hope it doesn't cut off. Okay, sorry. Yep. So we have 50% of our population covered by Pfizer. That proved to be a good bet for us because it's found to be very efficacious and effective in real life settings. It's, I think, the gold standard as far as the COVID-19 vaccine is concerned. We have an order from Astrazeneca that we concluded last year, which has not been delivered yet because it's fulfilled out of a factory in Thailand. We made some bets from the Chinese vaccines, and these are the inactivated vaccines, not the mRNA vaccines. We've started receiving our delivery of Sinovac vaccines. We were interested and are interested in the CanSino vaccine because it's a single dose vaccine like the Johnson & Johnson vaccine. And we also took a small order of the Russian vaccine, which is currently undergoing regulatory review. And that's also highly efficacious at almost 92%. So I think the thing to stress here is that a lot of countries are suffering because of what's happening globally with vaccine nationalism. Malaysia realized very early on that we are not in a situation where we are a low medium income country as defined by WHO. So we don't qualify for any donations, we don't qualify for any discounts or any preferred access via COVAX. We are categorized as an upper middle income country, so we have to make our own way in terms of vaccine procurement. And we decided early on that we would sign these agreements. But unfortunately, even though we signed these agreements relatively early, we find ourselves in a situation like many other middle income countries where the delivery of our vaccines is staggered throughout the year. And the saddest thing that we notice is the amount of vaccines that have been bought by developed advanced economies. There are some countries who've bought vaccines to cover their population 5 times over. And I think this is really an indictment on human nature, on the breakdown of global solidarity, of vaccine inequity. And it really shines a light on, I'm sorry to say, the true characters of some of these countries. And another observation that I want to make, since this is an ASEAN forum, is the lack of solidarity and coordination within ASEAN itself. I don't recall, and I've been here for the last year working on this, I don't recall ASEAN even proposing to negotiate together, to procure together as a bloc. As a bloc, we could have procured perhaps on a much accelerated basis with a bigger volume, but there was no attempt to coordinate our interests in procuring COVID-19 vaccines. Next. So this is the current numbers for Malaysia. We have about 8 million people registered. under the immunization program. That's 33% of the target that we want, which is 26 million. I'm not I'm not pressing the panic button yet, because I believe that a lot more people will start registering once they see more people being vaccinated. It's a fear of missing out kind of thing. So I think it will gradually go up, and I think 8 million is not too bad right now at this point in time. We have vaccinated at least 862,445 people have received their first dose, and 328,254 have received their second dose as of yesterday. So that's where we are in Malaysia. Next. Now, the immunization program is not just a public health program, it's also a program for economic recovery. And it's front and center of Malaysia's economic recovery program as well, because as many people know, a successful immunization program will lead to the opening up of the economy, which will also contribute towards economic recovery. What has happened in other countries? Now, the global leader in inoculation rate is Israel. Nearly 90% of Israel's over 50 population have either been vaccinated or have recovered from COVID-19. They were able to reopen the economy 2 months after they started their mass vaccinations. They've already seen massive drops in COVID-19 cases, in hospitalization. And in Israel's case, their central bank has said that there will be a strong economic recovery this year on the back of their aggressive immunization program. So this is a real life case scenario where the vaccination program has led to improved economic prospects. Next. And of course, whoever you talk to, whether it's IMF, World Bank, Fitch, other countries, projections are based on the speed of vaccine development. Everyone is saying that if you can get your vaccine development out fast, then economic recovery will follow. Next. So we are starting to see strong rollouts in ASEAN countries, and this is again this will be good for regional economic rebound. I think Indonesia has been very aggressive in their immunization program. Singapore as well, starting to look at reopening travel into the country, and other countries are basing their economic projections for this year on the back of immunization programs. Next. For Malaysia, we're forecasting growth about 6% this year, but again premised on effective rollout of the immunization program, and it's not just about the economic sector opening up, but it's about borders opening up. Next. Lifting up travel restrictions by creating reciprocal green lanes and travel bubbles is extremely important. Tourism is one of our biggest foreign currency earner here in Malaysia. As in all other countries, it collapsed last year. So it's very important for us to get reciprocal arrangements with other countries who have started to vaccinate in order for us to start opening up travel bubbles. Next. So one thing that we've done in Malaysia is to identify economic sectors in parallel to our immunization program. So if you remember earlier, I said that in phase 1 and phase 2, we are focusing on the medical frontliners, essential services, and also the at-risk population, elderly and those people with comorbidities. Once we start phase 3, which is the general population, there will be a parallel immunization program that will run alongside that, which is an immunization program that will prioritize the economic sectors. So we've identified manufacturing, aviation, logistics, oil and gas, transport, tourism, and certain services sector to immunize employees and workers in these sectors, especially where the rates of transmission of COVID-19 is high. We feel that by running in parallel with the general population, this special immunization program for the economic sectors will enable us to open up the industry much quicker, rather than having phase 3 run just on the general population alone. Next. Coming back to the travel thing that I mentioned earlier, so what we're doing now also in order to open borders is to try to get reciprocal or mutual recognition for our COVID-19 health certificates or vaccination certificates or vaccination passports. We have the WHO guidelines to base our technology on. We have a digital vaccination certificate on our app, which is done on blockchain. So it's very secure, immutable, and cannot be tampered with. We've already started discussing with Singapore, which uses blockchain as well for their digital vaccination certificate, and China, to have mutual recognition of these digital passports. And once we recognize each other's digital passports and provide the access to query the single source of truth, which is the database in the blockchain, that will make it easier for us to open borders when the time comes. Next. So that's a little bit about what's happening here in Malaysia. I'm sure there's loads of questions during the webinar today. So I'm going to stop here and I'll do questions. Thank you.
Okay. Thank you, YB, KJ. I think you rightly mentioned Israel's success. I hope we will try to learn from them. There was success also by Chile, but they are back in lockdown. So it is quite a mixed sort of story out there. Secondly, you very rightly also mentioned how the rich countries have more or less monopolized the vaccines. In fact, the rich countries, comprising 14% of the world's population, have bought up 53% of the vaccine supplies, which really sort of underlines the point that you've made. You mentioned also about the ASEAN rollout. And at this stage, I think I would like very much to invite SK Khor, Dr. Khor, to come in and discuss the very swiftly, I think, what's happening in ASEAN and what should happen in ASEAN. So if I could invite Dr. Khor now to come in, please, with the slides.
Thank you, Tan Sri Munir. Good evening, everyone. It's a pleasure to be here with you as Ilya puts up my slides, which I was requested to share with you. Allow me to make some opening remarks. Today is the 7th of April. Every year since 1953, the world has celebrated World Health Day. And this year's theme is building a fairer and healthier world. Indeed, the 7th of April is actually the start of the World Health Organization as well. The constitution dates back to 1947 on the 7th of April when it came into force. So today is a bit of a poignant day for those of us in the health profession. Thank you for joining us. Indeed, as we talk about vaccines and the COVID vaccine rollout and its impact on the recovery of the ASEAN economy, I'm reminded of a webinar that I just came off of, and that's together with a special advisor to Dr. Tedros Adhanom, who is Dr. Peter Singer. He's a special advisor to the Director General of the World Health Organization. And during that webinar, we spoke a lot about equity, and this is a theme that I hope to return to a few times in the next few minutes, especially as we talk about how we can help the ASEAN economy recover. Ilya, to the next slide, please. I begin with a short disclosure. I have no conflicts of interest, although I'm affiliated with 3 think tanks at the moment. The opinions expressed here are solely my own and do not represent any of the organizations that I'm affiliated to. Thank you, Ilya. Next slide, please. A quick note about Pathway 225, and I know that Juki and Tan Sri Munir have mentioned this earlier, but maybe it'd be beneficial for us to understand what's Pathway 225 so that we can link it back to the theme of today's conversation. 225 recommendations to facilitate a coordinated confidence-building mechanisms for Southeast Asia countries as they gradually reopen their economies. The recommendations came from ASEAN Business Advisory Council with the joint business councils with Europe and America and so on, and also sectoral champions, addressed to ASEAN leaders, specifically the Secretariat and the Summit and also heads of government. And it was released in June 2020 after the 36th ASEAN Leaders Summit. So Pathway 225 came from business to the heads of government in June 2020. I give four examples, of recommendations. For example, recommendation 16 is to ratify the RCEP before the 31st of December last year, and that was done. Recommendation 25 is to establish a mechanism for ASEAN pool procurement of vaccines, not done yet, and something that Minister Khairy has alluded to when he mentioned that there seems to be no coordination at the ASEAN level. Recommendation 41 is to establish an ASEAN-wide contact tracing system. We don't yet have an ASEAN-wide contact tracing system. So even if we have digital health certificates or passports, we may still need to download Trace Together in Singapore, or Singaporeans coming to Malaysia will still have to download MySejahtera because we don't have a, say, a coherent or a joint ASEAN contact tracing system, even though it's part of Pathway 225. And recommendation 83, for example, is something that's non-health related, establishing a formal ASEAN food security working group. Ladies and gentlemen, this is Pathway 225 and just a small taste of the 225 recommendations from business to government in June 2020. Ilya, to the next slide, please. In this slide, I want to share with everyone briefly what is the status of ASEAN vaccination programs today. I have this slide and also the next one, and then I'll be happy to have a more dynamic Q&A with everyone. So just two more slides. In this slide, we talk about what's happening today. In the next slide, we'll talk about what's likely to happen tomorrow. In the share of people who received at least one dose of the vaccine, these are not fully vaccinated people, but just one dose of the vaccine as of 2 days ago. I've picked some countries for us to consider. The United States is at something like 32%. Israel is the world leader, something like 65%. Serbia is at 21%. And then in ASEAN, we've got Singapore leading the pack at about 18% of their population already receiving one dose of the vaccine, followed by Indonesia, Malaysia, Cambodia, and the other ASEAN countries. But allow me on the left-hand side of the screen to make some remarks about the unique characteristics of Southeast Asia. I begin with Serbia. Well, Serbia's not really Southeast Asia, but it could be a good idea for us to see how a small country of 7 million people at the periphery of the European Union could give 4 vaccines to their population and get it up to 21% just 2 months into their vaccination program. So there could be some lessons here from Serbia as well. And Serbia is one of only 2 countries in the whole world that provides choice to their citizens. In other words, citizens today in Serbia and Hong Kong can choose which vaccines they want to be vaccinated with. Singapore, a note about Singapore is that they're researching their single-shot mRNA vaccine together with Arcturus Technologies. In Indonesia, they started with the Sinovac vaccine, solely with the Sinovac vaccine, but they started very early because they had clinical trials that eased their access. Malaysia has the highest number of vaccines approved in Southeast Asia. We have got 3 approved under the conditional registration pathway of our NPRA. Malaysia ties with the Philippines that also has 3 vaccines approved. Cambodia and Laos are reliant on the COVAX facility as well as external aid. Japan, paradoxically, has got very low vaccine confidence. So it's only at 0.7% of their population being vaccinated right now. And for those who are interested in vaccine confidence, I think Japan is a great case study close to us. In Thailand, they've got the Siam Biosciences domestic manufacturing and technology transfer agreement with Astrazeneca, potentially also to distribute out to the rest of Southeast Asia. Brunei was one of the later countries in Southeast Asia to start the immunization program, beginning with their king, Sultan Hassan, the Sultan Hassan al Bolkiah on the 3rd of April. And Vietnam also started a bit late as well on the 8th of March. Ladies and gentlemen, we can see here that ASEAN's not homogeneous, but this is known to all of you, and this is the status of ASEAN vaccination programs today. Ilya, to the next slide, please. And perhaps here, I would like to sketch out the next steps in ASEAN vaccination programs. This is what's likely to happen in the coming few months, perhaps even until the end of this year. I begin with 3 challenges on the top, and I'll provide 3 organizing principles so that we can restart the ASEAN economy. Firstly, the first challenge is vaccine supply. The second challenge is vaccine confidence. And third challenge is the variant strategy that we might need. In vaccine supplies, it's obviously we need continuous procurement because although Malaysia, for example, has procured 109% of our population, we may need to continue procuring because COVID is unlikely to just end even after vaccination. We may need to consider pool procurement at the ASEAN level, and we may also need to consider regional manufacturing, potentially in Thailand, Malaysia, and Singapore. And these three countries have got native industries with very good regulatory frameworks. In terms of vaccine confidence, it's education, 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 but specifically the management of adverse event reports. What I mean to say is, in the grand scheme of things, we will always see an adverse event or a spate of adverse events, and then the media might report that irresponsibly, and we have viral news on social media that causes a situation where you have scared the population. It's easy to scare a population, but it's very difficult to unscare a population. And that is what I mean by having a very careful and thoughtful management of adverse event reports, especially when they're coincidental with events like death or diseases and not so much causal. Thirdly, and finally, in terms of a challenge, we will need to consider a variant strategy. The new variants that are coming at the moment don't seem to have much impact on vaccines, but maybe at some point there will be a variant inevitably will come that will affect the effectiveness of vaccines. And therefore, we need 4 principles. Number 1, maximum suppression of disease transmission. Number 2, we need to build up our genomic surveillance in and across Southeast Asia. Thirdly, as quickly as possible, vaccinate the population, because when you vaccinate the population, you're reducing something called antigenic drift, which means that the virus will be less likely to evolve. And finally, to rely on science. Ladies and gentlemen, these are the 3 challenges in ASEAN vaccination programs between now and the end of the year. Here are 3 organizing principles to restart the ASEAN economy. But underlying all that is to understand that vaccines are not a magic exit strategy. Therefore, we need public health measures to have any form of a phased restart. So we cannot rely on the magic of vaccines, even though we manage to vaccinate everyone all at once. I provide 3 organizing principles. Firstly, antibody passports are better than vaccine passports. I hear what Minister Khairy has mentioned just now about blockchain technology to prove that you have been vaccinated, but more important than that is to prove that you actually have the antibodies. So if you can prove that you have the antibodies and you have a blockchain technology undergirding that together with a network of laboratories or even bedside tests for antibodies, I think this would be going a long way to ensure that you can travel very safely with a lot of peace of mind as well. So I'll say that antibody passports in the long term will be better than vaccine passports. There will be some quite overdue, I must say, low-hanging fruit for us to restart the ASEAN economy. Firstly, we digitize the economy, and any number of statistics will tell you that this is irreversible, that our movements towards 5G, 4G, and so on and so forth will be helpful for us to restart the economy. Secondly, in 2B, at the bottom of the screen, is for us to consider the private provision of public health goods. So things like contact tracing, testing, isolation, vaccination strategies, and the delivery of vaccinations and healthcare could be considered or shifted over to the private sector. Thirdly, and finally, in terms of restarting the ASEAN economy, it's not just looking at MNCs, but also to look at small and medium industries that variously in various countries are up to 99% of all businesses and up to 55% of the total economic size of various countries. So SMEs will help you protect the well-being of your citizens and also restart the economy very well. Finally, if I can end with one final and quite overarching organizing principle to restart the ASEAN economy. In the first year of the COVID pandemic, we've seen, and quite rightly so, a government-led economic and public health response. And this is necessary because the private sector simply had no time or energy or expertise to respond to a pandemic for which they had no experience. But in the second year onwards, we need to consider and actively encourage a private sector-led response. So as I speak to many of you who are captains of industry, you have capital and networks and expertise and innovativeness. What governments can do is to create a sort of a public policy framework that encourages and incentivizes smart regulation and competition. And we hope that the private sector will be able to provide a lot more public health goods than you have managed to provide in the first year of the pandemic. And with this note, perhaps Ilya, to the last and final slide, I return to this theme often. The theme is that health is not always scientific or medical, that it requires a political choices to be made. And in this case, regional health in Southeast Asia requires us to make some significant political choices as well, such as Pathway 225 that was launched last year. Thank you, Tan Sri Munir, for this opportunity. Over to you.
Thank you very much, Dr. S.K. Khor. Some very excellent points on the next steps for ASEAN and how to restart the ASEAN economy. But as YB Khairy had stated, there is a lack of solidarity and coordination in ASEAN, and we all know it too well in the private sector about how ASEAN has not responded in unity against this pandemic. Indeed, even when you sort of put up a kind of scorecard against Pathway 225, and you gave a tick against RCEP ratification, actually RCEP has only been signed and not ratified yet. It was signed in November. China is the only one that is rushing with ratification. The whole treaty will not come into force until the majority of the 10 ASEAN countries, i.e. 6, have ratified, and 3 out of the 5 non-ASEAN countries have ratified. We still have a long way to go, even on that small success story, if you like, Dr. Khor. So, ASEAN is way behind, way behind. Anyway, we'll come to ASEAN again towards the end of our discussion now, YB and Dr. Khor. What I would like to do now is to discuss. There's so many questions, as YB Khairy said, that have come in. There seems to me to be, there's a lot of anxiety in the Malaysian context, confusion, and even suspicion out there based on the questions we have received. And I think there is a question mark that's been asked about, are we making good progress? YB Khairy mentioned, the rollout, first phase, 24th February, then 19th February, and then the May target, when we'll get lots of supplies and adults will be vaccinated in parallel with economic sectors. I'd like to ask YB 2 questions. How do we compare with our peers? Are we on target in terms of what was announced as our rollout plan? You had mentioned, and it's understandable, that we may have made the orders, but the supplies are staggered. Is that our main problem in getting to be in line with our intended rollout plan, YB?
Yeah, thank you, Tan Sri. I think Swee Kheng showed a slide of where we are benchmarked against some of our neighbors. So you can see we're not doing that badly. Even if we benchmark against countries like Japan, South Korea, and Australia, we've done about the same as them, coming up to about 1 million doses. This is, in Malaysia's case, I have to say that at the moment, this is a function of supply. Our utilization rate is about 80%, about 80% of the vaccines that have come in have already been put into people's arms. It's not 100% because you have to keep the second dose, and although we roll the dose requirements, but we have decided that for certain cases, we keep a second dose in reserve for the second dose to be administered. So at 80%, I think that's quite efficient utilization of the capacity that's already been delivered. Once we get to June, July onwards, then that's when we really have to start ramping up the vaccination rate every day. We'll be targeting more than 160,000 shots delivered every day for us to finish by December. And that's where other things will come into play. So if I say that today, the rate is a function of the supply, later on, there will be other things that we have to troubleshoot. For instance, logistic problems, manpower issues, and also problems of getting people to appointments that we have given. So at the moment, Tan Sri, the answer is it's all about supply. The supplies are still short. You're on mute, Tan Sri.
Yeah, sorry. Of the 862,000 who have been vaccinated, how many of them have had both the first and second dose? That's point. When you say 862K vaccinated, it's mainly first dose, isn't it?
Yeah, so 328,000 have had 2 doses.
Oh, 328,000 have had 2 doses. Thank you. So, but then we also have this situation where it was reported yesterday that 62,837 healthcare frontliners have yet to receive their jabs. Is this true? Is that accurate? How come this happened? So that means we haven't gone beyond phase 1 then. If there are what do you call it? Those 62,000 yet to be jabbed. I mean, what's the reason for that, YB?
Yeah, I made that announcement. That's because some states missed out on GPs, some states missed out on private healthcare workers, and there were some late add-ons. For instance, private ambulance providers, palliative care, hospice care. So there were some that were added later, some categories that were added later, including traditional and complementary medicine, people who are involved in that. So we are trying to finish this 50,000 within this month.
Okay, thank you. But people are asking out there, YB, how are the frontliners defined? Who are the frontliners? Are they truly the frontliners? I know people are very skeptical of MPs, for example, and all MPs have been vaccinated. But but I don't want to go into that. Whether MPs should be made sort of safe to live further on. But other than that, I mean, how are they defined, the frontliners? I have lots of questions. People asking.
Yeah.
How is it defined?
Yeah, so there are 2 categories for frontliners. One is medical frontliners, and I think those are people involved in directly in healthcare. But that includes also not people just in hospitals and clinics, but as I said earlier, auxiliary services, community pharmacists. These were groups that were added on later. We also looked at a second category, and that's non-medical frontliners, looking at those people who are at the front lines of dealing with people, managing crowds, really at providing essential services. So we define that as security services, police, prison department, immigration, bomber, maritime agency, some parts of the armed forces, especially those who are having military exercise and training right now. The social welfare department, those who are going house to house, sending aid and food baskets. We also identified teachers with comorbidities. Of course, teachers, about 500,000, we couldn't give to all of them, but we decided to give to teachers with comorbidities. And the most controversial one was publicly elected officials. And we did this on the basis that epidemiologically, they are at risk of spreading and infecting people because of the sheer number of people that they meet, places that they go, and events that they attend to.
It's interesting. I mean, there's a question here from someone from the media, obviously. Are media people not frontliners? I mean, they ask whether media people can be defined as frontliners. Why?
Yeah, so Tan Sri, the task force that I run, the COVID immunization task force, we receive appeals from many people asking to be included as frontliners. And some of them we've included. For instance, we approved domestic trade, have enforcement officers that go out there and ensure that there's no profiteering and there's no price gouging by shops. So we've said, okay, that fair enough, they're frontliners. The media will be included soon. So we'll be offering shots to a certain number of representatives per media organization in this phase when more vaccines come.
I have one particular question from myself, actually. I was taken by your remark that from May, we'll get a strong sort of stream of supply of the vaccine, and then we're going to address the adults. But you said in parallel with workers in certain economic sectors. Now, how are those economic sectors going to be picked out? I mean, what are the criteria, to see who gets what? And then there'll be all sorts of complaints later on about sectors were left out, How are you going to do that? It's a tricky thing, isn't it?
Yeah. So we have a subcommittee that's led by specialists from the Ministry of Health as well as from MITI to determine the risk assessment of that particular sector and also the impact that sector has on economic recovery. So one easy sector that we've already identified for prioritization is manufacturing, simply because it has a huge bearing on the Malaysian economic profile, but also because manufacturing has been seen a source of transmission clusters, especially amongst manufacturing workers. So we landed on that quite easily. There are other sectors which we are looking at, for instance, aviation, that allows us to open our borders earlier. Singapore has fully vaccinated the SQ crew, for instance, so that's something that we're looking at as well. So it goes through a risk assessment as well as an assessment of the economic impact on that particular sector on the economy as well. It's not done randomly by just me.
It's going to be very difficult. I like your comment about we don't put all our eggs in one basket in terms of, and I'd like to bring Dr. Khor in here, in terms of our vaccine orders. And you've mentioned we have got 6 vaccine orders. I'm not sure what the COVAX vaccines will be, but I think that most of them were coming from India, I thought. So that the Astrazeneca, I imagine. I don't know, but you could inform us. So, as between these vaccines, which are the most efficacious? And I don't know, Dr. Khor might want to come in also on this. Dr. Khor.
Thank you, Tan Sri Munir. Swee Kheng or SK is perfectly fine as well. I did have a question for Minister Khairy, and allow me to ask that question for him to mull over for a second before I take Tan Sri's question about the efficacy of vaccines. Minister Khairy, you mentioned the JKPAV, which is the first I've heard of it, so that you can sort of have a committee of people to decide who should have earlier access. If you can you tell us a little bit more about the decision-making framework and what sort of criteria are used? And I think that will be helpful for everyone as well, because that's a little bit of a yardstick for us to measure the criticality of services. To Tan Sri Munir's question, if we about the say efficaciousness or the effectiveness of vaccines, we can look at some headline numbers, and at the headline level, it appears that the Pfizer and Moderna vaccines have the highest rates of efficacy at 95%. But we must also say that in real life, these vaccines that have been available on the market, and there are about 11 vaccines have been approved by at least one country around the world, they've actually shown a very good real-world effectiveness in at least 3 levels. Number 1 is to prevent death. Number 2 is to prevent severe cases. And number 3 is to prevent cases. And in all 3 respects, we're looking at efficacy rates of 60 to even 95% for all those vaccines that have been approved by at least one country around the world in these 3 metrics in the real world. So although the headline clinical numbers or during clinical trials for Pfizer and Moderna are the highest at 95%, in reality, it appears that the other vaccines are also doing very well. If we look at these 3 criteria in the real world of reducing deaths, reducing serious cases, and also reducing cases, and the efficacy rates range from 60 to 90%, and this depends on any number of variables. Tan Sri Munir, over to you, or maybe to Minister Khairy.
No, but I thought, I know you have a question for YB, but I like to follow up on with you on, and perhaps also YB. Let's take one of those 11 vaccines that you mentioned, and they are actually in our 6, in our basket of 6. This one is AstraZeneca. Okay, so we have all these recent sort of, well, if you like, fear mongering or fears, let's say fears, about blood clots and what have you. And I think YB Khairy announced, I think 2 days ago, if I'm not wrong, YB, that we will wait upon the experts' findings on this Astrazeneca vaccine before we decide to get them in. But I think there was then an announcement that we are going to get them in. And this has confused the public, on AstraZeneca. So there are 2 points there. One, is it safe? Okay. Two, are we bringing it in or not into Malaysia? But perhaps YB Khairy could answer the latter, maybe the former, SK Khor. I mean,
thank you, Dr. Munir.
Give us an assessment, a feel. People have got a lot of anxieties out there.
Maybe I'll answer in two ways, if I may. The first one, and your question is it safe? So the first way I'll answer the question is to give us a bunch of numbers and basically hoping to show that it is safe until we can prove otherwise, and therefore the benefits still outweigh the risk. Whenever you ask a doctor the question, is it safe? We find ourselves in a philosophical conundrum because nothing in this world is 100% safe. Not even life itself is 100% safe. So therefore, it's very difficult for me to answer this question in binary terms. But here are some numbers. 25 million people approximately have received the AstraZeneca vaccine across Europe. We've got about 25 cases of blood clots that are generally happening in younger women below the age of 55. Taken as a whole, this does not appear to be higher than the average of what might be expected, even if you are not taking the vaccine. So there is a background incidence of this blood clots, even if you don't take these vaccines at all. However, because of the safety signal, the European Medicines Agency is looking through this information to see if there is a causal link. At the moment, the assessment of the European Medical Agency as well as the World Health Organization is benefits are outweighing the risk. So this is, say, a set of numbers to arrive at the conclusion, benefits outweigh the risk. In reality, for Malaysia, if we adopt a very practical stance, perhaps we don't have to worry about it so much anymore and we don't have to react. My point being, we have a contract with AstraZeneca. It looks like they're going to fulfill it, but the first stocks will only arrive in June. So if we can wait for another month or so for some more assessments in real life to be conducted by other countries, we can then make a decision around May for us to see whether or not there's truly a need for us to cancel the shipment. My point being, for practical purposes, we don't really have to worry about it for at least another 4 to 6 weeks, and we can wait for other countries to give us more data. Over to you, Tan Sri Munir.
But I thought SK Khor, I thought the European Medicines Agency, the European Medicines Agency has suspended the use of AstraZeneca in Europe.
They haven't. So the EMA has not suspended. It's individual countries who have suspended the use and in various formats. Some of them, or at least 1 or 2 of them, have suspended outright for the entire population. And most of them are suspending for younger populations, variously below 55, 60, or 65. And this is pending some more research and data gathering by themselves as well as the EMA. So it's not the EMA that suspended, but rather it's a country-level regulatory agency.
Okay. All right, thank you for clarifying on that point. Then, of course, you mentioned that.
Can I just add to that point?
Yes, YB. Yes.
Yeah. So how we assess vaccines and whether the vaccines will be utilized for the immunization program is, of course, by observing what is happening in other parts of the world, especially with regards to adverse events. The AstraZeneca vaccine, of course, has been in the news lately. And we had a committee meeting yesterday to discuss this, and the expert committee that advises us briefed us on the AstraZeneca vaccine. It's coming in May from the COVAX facility, so we have a bit of time to decide whether or not to go through with this. At the moment, the EMA has not yet issued a report. That report will determine whether or not there's a causal link between the vaccine and thrombosis, cases of thrombosis or blood clots. and we will determine then whether or not we go ahead with it, or whether or not we go ahead with it with caution. So some countries have updated their use of AstraZeneca with caution given to symptoms or signs of blood clots after the vaccination is done.
Thank you, thank you. That clarifies something that rather confused people. So, we wait and see, and we have time to wait and see, essentially, and wait for reports to come through and how other countries have experienced it. Excellent. But you were SK Khor asking YB about something else.
Yeah, sorry. Yeah, SK asked me a question about how we assess these groups. So, what the Jawatan Kuasa Penilaian Permohonan Akses Awal does is it runs a risk framework on these groups, and it looks at the profile of people who are requesting for early access to see whether or not the profile of people applying, in terms of their age, in terms of their likely health situation, necessitates for them to be prioritized. They look at also the risk assessment of the environment in which these people operate, whether it is a crowded, highly physical and closed quarters environment. And we also look at the economic impact of that particular sector, and also other things like whether or not there is implications for foreign travel, of representing the country. So that was an interesting case of athletes representing Malaysia at the Olympics. And we've decided that that's both on a high risk assessment, because they're going to be in an area where close contact, physical contact, a lot of people at the Olympics, as well as representing the country. So they qualified according to the risk assessment. So each different group is given a score, and that score is then presented to the committee.
Thank you very much. SK, got any further points to make?
Thank you, Tan Sri Munir. Minister Khairy, great framework, and I appreciate this very much. At some point, it would be great if this was obviously made public, so that the public will be reassured that there is a rhythm and a framework to make decisions, and that decisions are not arbitrary.
Yeah. Well, the usual point about
I get that, and I want to run the program as transparently as possible. But as you know, this is unprecedented. We're just creating frameworks where none existed. So once we're comfortable with it, then of course we will explain this to the public.
Thank you, YB. I think it's a tough job, really very tough. I think if everything runs smoothly, people take it for granted. Something goes wrong, all hell will break loose. and so that's always the problem. Okay, we move YB. We can to herd immunity. I mean, this is something that's used quite loosely, and SK, you can come in also. And there's this problem, about herd immunity, that people don't understand how many percent of the population would, sort of serve to bring about herd immunity. People don't understand when Malaysia will achieve whatever that percentage is, the herd immunity, and then what should be our social actions and personal actions once we have achieved herd immunity. I mean, do we take off our masks and so on?
So I think the whole discussion on herd immunity is very, very uncertain. Nobody really knows. Nobody really knows what the percentage is. They used the standard formula and came up with 70%. It could be 70%. It could be more than that. But I'll explain why we don't know. We don't know because we don't know enough about the vaccines. We don't know how long the vaccines last for, and simply because there's no time data on this. They've been developed so fast. We don't know if they significantly cut transmission. We know that it prevents death. We know that it prevents severe COVID, but we don't know to what extent it prevents transmission. We also don't know about how this virus is going to mutate. And I think this is the biggest concern many countries have, that the virus continues to mutate. It becomes more aggressive. The vaccines become less effective and efficacious against the new variants, against the new mutation. And as SK alluded to just now, the worst case scenario and the most likely scenario today is that COVID becomes endemic. It just stays with us, and you end up having to take different vaccinations or booster shots every year. But there are two things that we need to do, and I'm happy that we managed to get the funds to do this from the Ministry of Finance. The task force and the Ministry of Health will have to step up on two things. One is genomic surveillance, which is what SK touched on earlier. Basically, that's to do genomic sequencing of the viruses that we find in Malaysia to ensure that we know what type of mutations are here. And that will impact on our procurement strategy so that we can start adjusting our procurement to buying more of the vaccines that are stronger against the strains that we find here in Malaysia. Second one is, again, something that was touched on earlier, which is serological testing, which is testing antibodies on people who have already received vaccines, people who have recovered from COVID, to ensure that people still have antibodies, are still generating antibodies against COVID-19. Otherwise, you can say that I've been vaccinated, 2 doses of the Pfizer vaccine, I'm perfect, I'm safe, and I'm going to go out there, and we don't know how long that immune response lasts for. So to me, I think non-pharmaceutical interventions like mask wearing, physical distancing, avoiding crowds, that has to stay in place until we are sure that we have a pandemic under control.
So we won't have elections in Malaysia then, will we?
Well, I mean, I don't think you have to reach herd immunity to be able to be comfortable to have elections. I think as long as the case numbers drop, a lot of people are vaccinated. So even if it's not cutting transmission, even if we're not at herd immunity, the worst outcomes of COVID are prevented for a large number of Malaysian population. I think that then it will be safe to have elections. I mean, if you're really waiting for 000 cases for weeks on end, that might be impossible.
Point taken, Wifey. Are you confident that whatever the level of herd immunity is, that level would have been achieved by the end of the year? I mean, some experts say, SK, you might want to come in on this, because some experts contend that if everyone's not vaccinated, by the end of the year, the new mutations of the virus would develop, and which would require new vaccines altogether. I mean, this is, okay, you've touched on that point, YB, already, but now in the cycle, would we be able to beat the gun? I mean, come to the line faster than the end of the year?
So, Tan Sri, I have public health officials, epidemiologists, immunologists, virologists advising me, the finest brains in Malaysian healthcare, and I always ask them the question: when can I declare mission accomplished? And they will never give me an answer, and that's precisely right. They cannot give you an answer. It is impossible to give an answer because the mutations are not happening at the end of the year, Tan Sri, they're happening now. The South African variant is here already. So we don't know how that's going to spread. We don't know which vaccines will become obsolete because of that new variant. It will continue, the targets will shift. The best that we can do is to just get everyone vaccinated as quickly as possible with whatever vaccine that's available. And that's what I can do this year. I can try to reach the 80%. Whether or not that ends this pandemic, nobody knows.
All right. You got any comment to make, SK Khor, Doctor?
I do, Tan Sri. To build on what Minister Khairy has mentioned, is to say that maybe in 2 ways. The first one is to say that maybe business owners and those who are in charge of capital allocations and decisions like that, we will have to consider the possibilities, probability even, that this COVID pandemic will be with us indefinitely. And it's also possible, secondly, that the moment you achieve 80% coverage, it's possible that you have to revaccinate again. What I mean is the first person who received the vaccine in Malaysia was on the 23rd of February, and that was our Prime Minister. The moment we achieved the last person to be vaccinated, and therefore we cross over the threshold of 80%, assuming we even know what the number is, we may have to revaccinate the Prime Minister, and the cycle begins one more time. I think there's a strong possibility, maybe even a probability, that this will be the state of affairs, and hopefully science will be able to come in where we give you a virus that, a vaccine, not a virus, but a vaccine that has the following attributes. Number one, multi-year coverage. Number two, resistant to variants. Number three, maybe even a pan-coronavirus, meaning the entire family, a super vaccine, so to speak, that can be valid for 2 or 3 years, single shot, temperature stable or thermal stable, with coverage for vaccine variants, or rather virus variants, together with a coverage for other coronaviruses. And I know that some scientists are trying to discover such a vaccine right now, and we may be able to get such a second or even third generation vaccine, hopefully as early as the late 2022. So this could be the situation that we face, Tan Sri Munir, that we can't exit this pandemic with a full stop.
Yeah, okay, let's go to one final point, since we're coming to the end of this thing. Thank you very much for all your inputs, Minister. And let's come to one final point. What you are both saying is you never know the risk, okay? Yeah, you don't know the risk. Can we define the level of risk we are willing to take, to let everything off again? What's the level of risk? Because I'm confused. We talk about the vaccine passport or pass. WHO says one thing today, another thing tomorrow. IATA has got this thing that they're doing, but WHO has said, well, they're not sure how long the vaccines will last. Therefore, we cannot rely on a vaccine passport or vaccine certificate, to allow free travel again, for example. So they say passport, is not good enough. And you, SK Khor, you also said it's not good enough from a different viewpoint, because you're talking about the antibody. That in other words, you must have tests. Now, is the government, on the one hand, YB Khairy, also looking at giving people the virus test devices, that they can undertake, which get results in about 3 hours? I believe they do it in Indonesia already. You have Indonesia does it upside down, right? The younger people get vaccinated first, and they are moving about freely, in Indonesia, and they take tests themselves and show the results. They do it every week or every 2 weeks. So it would seem that the vaccine has to be augmented, and the level of confidence can only grow if you've got something else coming along with the vaccine. Are we looking at that?
So Tan Sri, the My Sejahtera app, which will be essentially the health passport, your health passport, has 3 components to it, and we are ensuring that the other 2 components have as rigid back end as the vaccination back end. One is a COVID test. So that's either your RT-PCR, which is the gold standard, or the RTK antigen, the rapid test kit antigen. And the second is, of course, your vaccination details, your vaccination certificate and proof of vaccination. And third is the serology test, what SK mentioned earlier, which is your antibody test to show that you still have antibodies against SARS-CoV-2, against COVID-19. So we will be using a blended, a mix of these 3 to allow for people to start doing things again. And I think that other countries will as well. Maybe 2 out of 3. For instance, I just saw from somebody sent me the requirements for traveling to Doha, to Qatar. Now you have to show that you are vaccinated, fully vaccinated. That means 2 weeks after your second dose. They list down the vaccines that they recognize. So it's Astrazeneca, A&J, and Pfizer, if I'm not mistaken. And they also insist on you doing a COVID-19 test, a PCR test, not more than 72 hours before you leave for Doha. if you can show both, you're negative as well as you're fully vaccinated, then you don't have to be quarantined. So I foresee that Malaysia, as well as other countries, will adopt a combination of these requirements. It's not good enough for you to show that you've been fully vaccinated, but you have to do maybe a quick test. If you want to go for a conference, you have to do a quick rapid test kit, antigen test kit that can get results within a couple of hours, and then you're free to attend the conference. So I think this will be the new normal. I mean, if the new normal was shut down, lockdowns, the new normal will be, showing your vaccination certificate, your antibody proof, and as well as doing your regular COVID tests.
I'm sure you agree, don't you, SK?
I do, Tan Sri Munir, because it's not as easy as just I've gotten my vaccinations. Leaving aside the fraud, tampering, and criminal elements, right? Proving that you've been vaccinated is not enough, because questions will arise as to when you got the vaccination, and even if you got it yesterday, whether or not you have the appropriate immunologic response for you to be able to say that you're truly protected. So it requires a basket of solutions. If I had to pick just one, I would say antibody testing to prove that you're truly protected. But I think antibody testing, perhaps even proving that might not be enough, and you need a set of criteria for you to fulfill before we can restart, say, mass movements again.
What mass movement, I mean, what about tourism? Okay, tourism is an industry, I think YB Khairy mentioned, so important in ASEAN particularly. And of course, Thailand, I mean, gosh, almost 20% of the GDP is tourism, related. And Malaysia is no mark either. So, I mean, when can we see tourism? We can't even travel interstate at the moment, right? And so what would it take after we've been vaccinated for us to be able to travel to Thailand, or for us to travel interstate, or to go to Singapore? We talk only now about bubbles. We talk about travel bubbles, which sort of almost by definition talks about a bilateral sort of arrangement. Would ASEAN ever come to its senses and work on these measures of risk and measures of protection to allow ASEAN travel, whether it's tourism or business or what, or political, all the meetings that need to take place, will it ever happen, you think? What would it take to get ASEAN to move? We're not talking about interference in domestic jurisdiction of other countries and so on,
Yeah. Tan Sri, I think the Business Council of ASEAN has to lead this. I don't think ASEAN institutions, political institutions, has the bandwidth to understand this or to process this. The reason why we have to move bilaterally is because I can't wait for ASEAN. I have to discuss with Singapore. I have to discuss with Thailand. They're ready to discuss. If we're going to wait for a regional set of rules from ASEAN, I think we'll wait until we cure cancer before we're going to get ASEAN working together on this. But I think we have to go with bubbles for now because it's contained. So just as an indication, at today's Security Council meeting, we were talking about doing a Phuket. So basically, Thailand is going to experiment with Phuket as a sandbox where if you're fully vaccinated, you can go to Phuket, I think in June or July, starting June or July, without having to be quarantined. Thinking of doing that for Langkawi. And of course, the requirements are not just people are vaccinated coming into Langkawi, but the DG of Health says that you must make sure that everyone in Langkawi as well is vaccinated. So we're looking at Langkawi as a potential sandbox for this travel bubble.
Thank you very much. SK, got any closing remarks to make in respect of risk-taking, protection, and travel?
Sorry, here I am. I'll make a small comment and then a larger one to end. I agree that with Minister Khairy that we cannot wait for ASEAN to take action. So I think the private sector can take some action over here. Examples of companies would be those who do laboratory testing and those who are in charge of travel and tourism, or even IATA or organizations like that will be able to form some sort of a consortium. And I agree also to the bilateral approach. This was something that I have written about quite extensively together with the National University of Singapore around August last year. Any attempts at travel bubbles or travel zones, rather, for Southeast Asia will have to begin with bilateral arrangements that sort of coalesce whenever there's some sort of, say, a harmonized standard. We will meet in the middle to have a harmonized standard for the entire travel zone that begins firstly with bilateral connections. Tan Sri Munir, allow me to make a final comment about risk-taking or acceptance of risk. Life is inherently risky, and I think how do we determine the right level of risk to accept? And that probably requires a social contract to be signed between the political leaders and society, and that requires a lot of education and a lot of public discourse as well. And different countries will have different conversations and different risk appetites, for example, and some will be more cautious and some will be a bit more aggressive for various good and bad reasons, and I'm indifferent to that. But the point I'm making is the earlier these conversations begin, the better it would be for the rest of the world, because I'm sure that we will regress to the mean or converge upon some harmonious, say, acceptance of risk. It might take us 1, 2, maybe even 3 years to arrive at some sort of a global acceptance of risk, noting that there is no ideal levels of risk acceptance for us. Over to you, Tan Sri Munir.
Thank you, YB Khairy. Thank you, Dr. S.K. Khor. I think we've gone through a heck of a lot of ground, and YB Khairy has been very open and very patient with questions that he knows he has asked himself and problems he knows he has faced himself being thrown at him again, and but there is a lot of concern out there, and SK has been as calm as a good doctor, and so sort of been talking to us about risk. But I think at the end, YB Khairy is right, and I agree with him. He used the term earlier on in his presentation, demonstration effect. The demonstration effect of the good that can come from a bilateral relationship or a trilateral relationship, which allows good to come out of it in terms of tourism or whatever it is. That demonstration effect will make other countries want to do the same and join the club, so to speak. And that's the only way ASEAN can go. But the private sector can start this, but there are regulations we will face the moment we come to the border. There are regulations we have to face, and that is the problem with ASEAN, which is so frustrating. And I hope a calmness of people like SK Khor can sort of make ASEAN people, ASEAN decision makers see sense, and the thrust and dynamism of people like YB Khairy will allow economies to start opening again with bubbles upon bubbles and bubbles growing. But we are still a long way from that. But we have started. Thank you both. Thank you, YB Khairy, very much indeed. And thank you, SK Khor. And thank you, everyone, for being with us. And can I say, keep safe, keep safe. Okay, and I think Joki wants to round everything up. Okay, okay.
Thank you, Tan Sri. Before I close, I actually have a question for Minister Khairy, because I noted that he said earlier in his presentation that he's not aware of any existing effort among ASEAN member states. And I'm not sure that you aware that there is this committee that's called the ASEAN Consultative Committee or Council, a working group on public health emergency, whose members are from the Ministry of Foreign Affairs. In the last ASEAN Economic Ministers retreat, just last month, I believe, we've been informed in the meeting that some form of collaboration among ASEAN member states has already taken place. We were quite surprised by it, but I don't know whether for practical reasons or consideration that's a good place to start. Just throw it there before I close.
Yeah, it's called the ACCPHEWG. In great ASEAN tradition, everyone knows what it stands for. I've attended a couple of their meetings, and it's not just the foreign. They report to the foreign ministers. Yeah, these are experts that come. Usually, they are from the health ministries and health departments. And our dissatisfaction with it is they just discuss things. Nobody decides. Nobody decides. You
I
know?
was just about to say that, Tan Sri. I mean, even if this thing exists, I'm on the ground implementing the vaccination program here in Malaysia. It makes absolutely no difference to me. It's done nothing for me.
Yeah, I think they got
Yeah.
they got to get their act together, Joki. Is there anything else you wish to say, Joki?
No. I just thought that the communication, there's a lot of silos, and something that we've been informed that there's collaboration, obviously is very compartmentalized, and maybe, somebody like Minister
Yeah.
also is not aware of. Anyway, I think that concludes this discussion. Our thanks to all the speakers for your very insightful sharing, and of course some questions have been answered, some not, and some bit our future remains a lot more for us to find out how long it will require for us to work on to exit this pandemic. And of course, for those of our panelists, or rather our participants who have sent in your questions, and if the discussion hasn't addressed your questions, we apologize. But until we meet again, we want to thank you for spending your past 90 minutes with us. And thanks again. Please support our work, and please follow us on our social media accounts. And until we meet again, stay safe and take care.
Thank you. Thank you. Thank you. Thank you.
Thank you.
Bye-bye.